Yes, immediate loading implant procedure is patient friendly. It is minimally invasive surgical approach. Yes, immediate loading implant procedure is patient friendly. It is minimally invasive surgical approach in which there is no need to cut the gums, there is no need to open the gums to place the implants. So of course there is no need for sutures or stitches. Because of this, there is minimum pain to the patient, there is minimum bleeding to the patient and minimum swelling to the patients. So this approach is very patient friendly. If you see the healing of the soft tissue on the second day of implant placement, it is excellent. It is the most suitable approach for the patients with the diabetes or patient who is on blood thinners or any health medical disease. Many patients ask us, do I need a bone graft? And we say, no, you don't. And they are really amazed. The reason for this is we engage the implants in that bone which is always available even in most atrophied or most deficiency cases. The success of the implant placed in the patient's own natural bone is far more better than that placed in the artificially augmented bone. Many dentists still recommend go for a bone grafting procedure, go for sinus lift procedure and create some artificial bone and then they place implants. But the predictability of this results is not 100% sure. They are unpredictable because they are artificially created bone and they are functional on to that level compared to that of the patient's own natural bone. Hence my recommendation to such patients to utilize a graftless solution for the implant treatment, and it is available now today. Well, if you have been advised sinus lift surgeries and there is no bone below the sinus to receive the implants, still it is possible to receive the fixed teeth by avoiding sinus lift surgery. How? We place implants on the back side of the sinus and on the front side of the sinus. The implant which is placed on the back side of the sinus is in the region of the pterygoid. So pterygoid region implant is called as tuberopterygoid implants. The implant which is placed in the anterior area of the sinus, that is in front of the sinus, it is the premaxillary area. We place bicortical immediate loading implants. And sometimes we engage the zygoma bone, the cheek bone, which is very rarely used but in highly atrophic cases. So by using patient's own bone, it is possible to load the implant immediately without doing any sinus lift surgeries. We have understood well that patient comes to us not for the bone formation below the sinus. Patient comes to us to receive fixed teeth, and utilizing the patient's own natural bone wherever it is available, it is possible to avoid the sinus lift surgeries. So it is my recommendation to the patients who are seeking or who have been advised sinus lift surgeries, they can still opt for the graftless solution with the help of immediate loading implants, and you can receive teeth in shortest period of time, like 3 days, not to invest for more of a time like 2 months or 6 months for the same.